Bonjour everyone, I am Anne-Lise Cailliez and welcome to Parlez-Vous CEO, where we teach the corporate talk and get real about entrepreneurship. Each week, I chat with founders and CEOs who build businesses their way, through the failures, pivots, and breakthroughs. And they bring the fire. Plus, I'll drop some golden nuggets of wisdom from my own entrepreneurial journey. This is your space to grow, learn, and evolve with a true growth mindset. Remember, success isn't about perfection, it's about persistence. Now let's kick things off and get this party started. Hello, bonjour, bonjour, hello. Welcome to another episode of Parlez-Vous CEO. My name is Anne-Lise Cailliez and I am your host. And I'm super excited to have with me Christina DiBernardo. So meet Christina, the Long Island native who launched Expressive Connections in 2020 as a solo practice and scaled it to 23 therapists in only 2 years. Christina, in your own words, would you introduce yourself and tell our audience who are not familiar with you a bit about your background and story and how you came about starting your own business?
Sure. And thank you so much for having me on today. I'm really excited to be here. My name is Christina DiBernardo. My practice is Expressive Connections, mental health counseling. I am a mental health entrepreneur, speaker, advocate, and practitioner. I started out in this field with an interest in just finding the best way that I could to really serve people and meet different needs in the mental health space. And I actually started my career working at a domestic violence agency, and I went as a volunteer. I thought that I was volunteering to work with women who had been battered and abused by their partners and their families. And it turns out that what I actually volunteered for was working in the batterer intervention program. And so that program was actually a court mandated program for the men who are abusive to their partners. It was a psychoeducational program to help them learn better ways to be better partners and fathers to their spouses or partners and children. And I thought that there was no way that I was going to stay, that I was going to do the first day and just, say this wasn't for me. And a few years later, I found myself running that program because I fell in love with the work and I fell in love with the way that my mentor there showed up for these individuals and just taught new ways of how to connect with women, with their children, with other people. And it made me fall in love with a certain type of work and a certain type of clientele, and really focusing on, how can we strengthen families? How can we strengthen relationships between people? And so the idea for Expressive Connections kind of came from that work, honestly, and major shift from what I do now. And Expressive Connections has become a practice that is really family centered and building up family units. The private practice that I worked at prior to starting my own and actually purchasing from my mentor the assets of her business, she was very focused on working with children and helping children overcome anxiety, depression, challenges within the family unit, their parents, and things like that. And so I've kind of taken both the knowledge that I gained from working under her and the experience at the domestic violence agency, and I kind of fused them into not a how can we, prevent violence in the homes kind of a thing. That's not really the work that we do, but just how can we really strengthen the family? And how can we focus on not just the child or not just the father or the mother, but the whole unit?
That's incredible work. And Christina, your mentor trusted you enough to sell you her practice. What did that mean to you, and how did you honor that trust while making it your own?
I was, to use the word that you used, honored. I was honored to have her look at me in that way and say, Christina, not only do I trust you to take my baby that I have worked really hard on for and nurtured and cared for the past, I think she was in practice in one capacity or another for 2 to 3 decades. So, not something that she had for only a few years and then said, I'm done. But, this entity, this baby of hers, and say, I've raised it to be, 20, 30 years old. I would love to entrust in you to make it something else. And so it was truly an honor. And I still have such a wonderful relationship with her. Honestly, I look at her like another granddaughter to my child. We have such a beautiful relationship still. It was really wonderful just to have somebody look at me and say, not only do I trust you with this, but I also know that you are capable of doing this. Because those of the audience who are listening, who happen to either be entrepreneurs or have somebody in their life who's an entrepreneur, you know that it's not easy and it's not for the faint of heart. There's a lot of work that goes into it. There's a lot of just nuances and little things that you don't necessarily think of beyond being a practitioner, which is what I went to school for. I went to school to become a therapist and work with people. I didn't go to business school. I still have not taken a single business class. It really has been learning while I'm doing. We have, as you kind of introduced, we went from, when I absorbed her practice, I think there was a group of about 5 to 7 of us, including some administrative staff. So that wasn't just practitioners. Now we are at, I believe, 26, and most of, if not all of us are practitioners, with some people doing little bits of admin work here and there, depending on their role. It's been a really cool journey over the past few years.
An amazing journey, and growing from 5 to 26 therapists is really incredible growth in such short time frame. What do you feel has been the most rewarding part of that growth, and what's been harder than you had anticipated?
Those are good questions. I will start with the rewarding part. The most rewarding thing about this for me is getting to participate in the growth of other clinicians and getting to support them in their journey, finding the type of practitioner that they would like to be, showing up for their clients in the best way that they know how, really drawing on each individual's strengths as a human being. There's somebody who was with my practice for a bit and has now started her own and is doing really, really well. And I remember first meeting her and her telling me her background was she was a model, and she was so insecure about that, like what business do I have being here, essentially. And I remember telling her, and she still tells me to this day that she never forgets that conversation, that was a conversation that was life-changing for her. And I remember telling her that she has traveled the world. She has done something and been successful at something that nobody else has. What are things that she has seen? I'm sure she's struggled with challenges on her own. Are there things that she saw with women struggling with body issues, with just navigating a professional career at such a young age? There's so much value that she has just based on that life experience. It is not something to be discredited. And so being able to work with people like her and other people that have worked with me, and just being able to help them see that they have so much more to offer than they realize. I think that's been the most rewarding thing for me as a business owner with this many staff.
Amazing. That sounds so profound. And so I see the beauty of it. Now, what was harder than you had expected?
The most challenging part of being a business owner, and this has led me to offer new services, has been decision fatigue. I think at any given day, I was having a conversation with my husband just yesterday, and just talking about how many decisions I have to make in a given day, from what am I eating for breakfast to, am I hiring this person or that person? Are we changing this policy and protocol? This family that we've been working with for, a few months has been, behind on their payments and, responding to staff dismissively and disrespectfully. Just, somebody asking me, has the Wi-Fi password changed? Just being pulled in a lot of different directions. I don't think I realized in the beginning how stretched thin I would be. And it actually led to me getting really sick for the first year that I had a group practice, solo practice, and then working with somebody else. No, but entering into this group entity, business ownership, responsible for more than just my own financial well-being, it led me to getting really, really sick. I was getting really bad vertigo episodes. And for those of you who know what vertigo is, you get dizzy. And for me, it wasn't just about getting dizzy for a moment here or there. I was getting dizzy to the point where I was almost passing out, and I wasn't able to stand sometimes for a week at a time. My husband was helping me go to the bathroom and showering because I was so not steady on my feet. And I don't blame the business. It was more of my lack of, at that time, just lack of awareness and how demanding this would be. So it took me about a year and a half working with, my doctors and just really working on myself to get to a place where I was healthy physically, but then also really restructuring how I went about being an entrepreneur to keep myself healthy, and not just keep myself healthy, but keep my practice healthy.
This is incredible what we are sharing, and very insightful for other people who are exactly in this situation. And how did you do that, Christina? How did you restructure your involvement with the business, the demands of a business, and exactly what you're describing, decision fatigue, which is really real as you're starting a business, and especially if you're scaling so quickly?
Right. I think most leaders experience decision fatigue in some capacity or another. If anybody who's listening is in a leadership role, at the end of the day, if you come home and, maybe you're partnered, maybe you're married, and your partner says, "What would you like for dinner?" That's the worst question anybody can ask you, because it's another decision at the end of the day. I don't ever want to decide what to eat for dinner. I just want someone to put food in front of me, even if it's, slime. I don't care. Someone make the decision and I will deal with it. But in terms of how I've really just changed the way that I approach business, and something that took longer for me to learn, just because I love the work that I do. And it took me a while to realize I can't work for my business. I have to work on it. And what I was doing was working for it and on it. And what that looked like was mostly working for it, because I never really gave myself the time to work on it. And so in the beginning, I was seeing many clients a week, therapy clients a week. I was also doing all of these supervision meetings with the new staff, with the clinicians that need supervisors. I was doing all of that while not taking a step back to look at, well, where are we from an accounting standpoint? Are we doing everything do we have the infrastructure to really grow? And we did not at first. Once I recovered from being really unwell, I had to take a look and say to a lot of my clients, "It's been such a pleasure and such an honor to witness you and be a part of your journey for such a long time. As this business grows, I have to change my role." And so I found clinicians within my practice that I trusted with the lives and well-being of the clients that I was working with. I still have a very small caseload now, but I really took the time to shift my own role and work with other people within my practice to take on different leadership roles, so that someone else could be really focused on the day-to-day supervision. Someone else could be focused on the day-to-day communications and marketing and things of that nature, so that I could really focus on bird's eye view. Where are we going and how are we going to get there? And so that was really helpful, just to I had to live through it. And for anybody out there who feels similarly that I do, I am somebody who wants to believe I can do all of it. And I think recognizing that doing all of it means finding balance and finding ways to include other people within your personal or business support network who can show up and do things that will keep your business moving forward, so that you can also focus on the bigger picture pieces of all of it.
And how did you come about these conclusions? Did you speak to your peers? Did you have a mentor? Because what you're saying is essential, what you're describing just now, working in the business versus on the business. So how did that wisdom come? Because I know the trigger was the health issues, but then how did you decide to rearrange how you were working?
I still have a few mentors. I am somebody who believes that you as an individual, and regardless of your industry, be coachable, be teachable, and find people who are smarter than you. Find people who know more than you do about anything. It doesn't really matter. And so I have some really wonderful people in my life, first of which is my husband. My husband has a very entrepreneurial mindset, and he's honestly brilliant. I love him so much. And he was one of the first people to say, Christina, you can't keep doing this. Because he saw it. He was helping me go to the bathroom. Let's put that into perspective. And, so he was the first person to tell me, Christina, you can't keep doing this. You have to take a look at what your day looks like, because this is not sustainable. You're working 12 hours a day, just seeing clients and taking meetings. You're not even giving yourself time to have lunch. You're not giving yourself time to make any big decisions about where to move your practice forward, how to move your business forward. You're not doing that for yourself. You're not taking the meetings that you actually need to take. You're focused on too many other things. So between him and then quite a few other mentors, one of whom was short-lived. It was only a few conversations, but I met him in a networking group, and he's a former CEO of a really large company, and he took a liking to me and said, I'd really like to just kind of have a couple of conversations with you, because I see your vision and I'd love to just kind of talk to you about how you're moving that forward. And he brought up some of the same points as my husband did, but he really helped me kind of structure. And he even went through, like, tell me about your staffers, who's got what strengths. Maybe you can move this person here and put that person here. And so we only had maybe 3 conversations like that, but it was 3 really impactful and meaningful conversations where he really helped me with the just organizing, and how to move people. And so from there, I read books that people recommended, and I listened to the people around me, both personal relationships who told me, Christina, we see that you're burning out. You can't keep doing this to yourself. And a personal connection who said, you've got a wonderful vision. You just have to back away from the day-to-day stuff and really focus on the big decisions to, how you're going to move forward and grow this into what you can grow it into.
Absolutely, Christina. I think this is really an important point that you're making. It is essential to be surrounded by the right people, the right mentors, because starting a business is really hard. Scaling a business is even harder. So if you don't have these reference points of perspective, experience, and sometimes when you're just not seeing things clearly, how important it is to have that support system. And Christina, you're clearly great at networking and you're great at speaking, yet I remember you mentioning social media isn't your strength. How have you navigating building a practice in a world that seems to demand online presence?
That is a good question. And it's true, online social media, it's not my strength. I don't even know how else to put it. But what I can say is that I truly enjoy connecting with people right there in the room. That is where I think I show up strongest when it comes to networking. And so the marketing avenues or the marketing paths that I've taken, one, it was really helpful to start off with a practice that was in the community for as long as it was, albeit small. It was there, and the pre-established relationships between my mentor and the community at large was, I couldn't have asked for anything for a greater gift when starting a business than to have a pre-established reputation there. And how I've grown that is I've reached out to medical practitioners in our community, and I've set up meetings and conversations. People have found me, and instead of taking the time to have a 15, 20, 30 minute, 1 hour conversation with somebody, I take the time and make sure that I prioritize that. I signed myself up for different networking organizations and groups, and I attended meetings. I met people in different industries from mine, but who value and need mental health referrals. A really unsuspecting source of referrals has been divorce attorneys and family law attorneys, where there are families who are, and I mean, if you think about it, those are families who are in crisis, and not very many people will take on working with children and families who are in that type of crisis, but we do not shy away from things like that. And so building on showing up at events, booking tables and booths at different events, and anywhere that I can really get myself or a representative from my practice physically present to have these conversations with people has been, I think, my bigger strength when it comes to the marketing and networking. And I've let somebody else in my practice who's much better at content creation and, having more of an online presence take that over. I know what I'm good at and I know what I'm not.
Absolutely. I think it's so important to know what you enjoy doing as well versus what drains you, especially as a business owner. So, Christina,
Yes.
between seeing patients as you're doing, managing 26 therapists, speaking engagements, in-person meeting, growing the business, how do you decide where to focus your energy and what gets sacrificed?
That has been a question that I ask myself almost every single day, especially since becoming a mom. I have an 8.5 month old. I gave birth in January. And so this year, I think, has taught me more than the past 5 years altogether, because I'm not only growing a business, I'm growing a person and I'm raising a person. And so one of the things that I've really looked at recently is, what are my peak energy hours of the day? Something really simple. And I block off that time of day just to focus on deep focus work, whether that is answering emails, creating content for presentations that I'm giving, reaching out and networking with people, following up with people that I need to follow up with. That is the time that I really focus on that. And then I have designated hours or a designated day that I see my clients. So I've really set up where there are blocks of time based on my energy, not just as an entrepreneur and business owner that already has a lot going on, but also as a new mom who is trying to also focus on being there for my infant and working through some of the sleep deprivation. Any fellow moms out there know what I'm talking about, and work through some of that sleep deprivation as well. And so the biggest thing for me has been setting really clear boundaries and intentions with myself about my time and blocking off certain hours of the day. For me, it's the mornings. I'm most productive in the mornings, and I am most focused and can really get a lot done, even in only a few hours, first thing in the morning. And then in the afternoon, when my energy is a little bit less, or I'm able to be in more of just a kind of go with the flow state, that's when I'll meet with my clients.
And Christina, some of the main challenges that I see founders like you in the mental space experiencing is either finding talents, recruiting, or finding patients. In your journey, which one has been the challenge that you have had to overcome the most?
Depending on the year, it's been both, honestly. Right now, I would say that hiring has been the bigger challenge than finding the clients and finding the patients. They're calling. And I think one of the bigger challenges now is finding the therapists. There are a lot of people out there who are really passionate about this work, and private practice is a very different environment than an agency setting. It's a very different environment than a hospital setting. And hospital settings, outpatient settings, the treatment process is usually quite quick, and people are in and out. Whereas private practice, we really do get to take the time to meet someone, learn who they are and what makes them tick as a unique individual, what their strengths are as a unique individual. And I think that a lot of practitioners going through the educational process that they're going through now and in the internships that they're going through now, sometimes they miss that because they're in settings that promote them to move much quicker than they do. So it's been a bit of a challenge to find practitioners who want the caseload volume that private practice comes with, or that it should come with, as well as having the confidence in their skills to step out of a solution-focused perspective and into a person-centered perspective.
And Christina, when you and I discussed, I remember you said you love speaking and you clearly also love sharing what you do. Share with our audience what really lights you up about that. And when did you realize that was a part of your calling?
What lights me up about getting to speak is that I now get to show up for a larger audience. I really love drawing out people's strengths. What are you good at? What makes you unique? And how are you going to reach the same goal that somebody else has, but on a different path? Because your strengths, your talents, and where you're at looks different from the person sitting next to you. And getting to speak and getting to present in front of a larger audience, or engage with, rather, because I prefer the engagement. Being able to engage with a larger audience allows me to do that. And public speaking has never been something that I shied away from. I learned that pretty early on. I've always found myself in leadership roles, whether that's professional or personal or academic. I was always the person in a group setting saying, okay, how can we organize this? How can we, what steps do we need to take? How can we plan this out? Okay, you're good at this. we're going to delegate. So I've always found myself in that position, in that role. And when I was working at the domestic violence agency, like I mentioned, that was all groups. That was all, a group of people, and not just a group of people that I had to get up and speak to for 2 hours, because those groups were 2 hours apiece. I not only had to get up and speak to them and educate them, but my audience hated me. My audience didn't want to be there. They didn't hate me, but my audience didn't want to be there. My audience was there because a judge told them, or a CPS caseworker or their lawyer said, you need to do this because you did something really bad. And in order to potentially avoid jail time and in order to have a right to visit with your kids, you need to go through this program for 8 months. And you need to convince the person who's leading this program that you're a safe person for your family to be around. And so I was the enemy. And so I had to convince this group of people that I wasn't their enemy. I had to convince this group of people that this could really add value to their lives if they were willing to listen, if they were willing to take a different look at themselves, take a different look at how they show up with their families and with their partners, and make meaningful changes. I kind of just fell into it very naturally, and I hope that I made a difference in a lot of families' lives. I mean, who knows? Someone could have been just like, yeah, Christina, this is great, and I'm making all these changes and, just pulling one over on me. That's always possible. But I hope that I made a difference in people's lives then, and just finding myself in that position and taking to it more naturally than I think I realized that I could is what sparked an interest in doing this long term and making more out of it, not just speaking to people who were court mandated to be in a program, but people who really wanted to make a difference in their own lives and actually take the steps to do that.
And Christina, I know that in your work, you like combining humor and heart, which is pretty unique. So how do you give yourself permission to show up that way in a field that can be serious?
That is a good question. I don't even know if I know how to answer that question, honestly, because I think that it's just kind of naturally how I am. Always try to, and I don't make light of things that are serious. I would never diminish what somebody's experiencing by making a joke. And that's not where, combining humor and heart really what I take that to mean. But I think that fine. I think letting people show up authentically as they need to, and me showing up as authentically as I can. I'm not the best fit for every client. I'm not the best fit for every mentee that comes my way, but I'm a good fit for the people that I know that I'm a good fit for. And recognizing that is really huge. And so I always, whenever I meet somebody new, whether they are a client or whether they are somebody that I mentor, I always let them know exactly how I work. I let them know that I am unbelievably transparent, that what you see is what you get. I can't hide it on my face. If I'm not saying it, my face is. I'm one of those people. And so I think just being authentic and showing up transparently has really worked in my favor with the people that have gravitated and done good work with me. And I've done good work with them. And so I hope I'm answering the question well, because yeah, that might have been the toughest question that you've asked me so far.
You're welcome. So, Christina, I also know that creating an LGBTQ affirming, body positive space clearly mattered to you. Can you share with our audience what shaped that commitment?
I did an internship during my graduate degree program at a local non-for-profit, and that entire organization was focused on working with LGBTQ plus youth. And it was a population of people that, I mean, don't get me wrong, I think everybody knows somebody who is a member of that community, but to be there firsthand, to really hear about their lived experiences on a day-to-day was really moving for me. And when I had the opportunity to have my own practice, I wanted to make sure that I had clinicians here that would always be available to showing up for that community, especially in a world that shames that community, and in a world that, whether they're shaming them or not, is ignorant to what certain people go through on a day-to-day basis. And so that internship and the people that I met there, and not just the clients, but the people doing the work, amazing, amazing human beings that care so deeply about the work and are also members of that community, really motivated me. And one of the things that's important to me about my practice is that we don't have a wait list. Not because we're not busy and not because we, are full, in that capacity, but the goal is to never be full. The goal is to continue to grow so that we can continue to have the reach that we have. And that means having an eclectic group of therapists, people who work with children.
Everything that you're juggling at the same time, what brings you back to why you started this in the first place?
Clients and getting to, because when the clinicians that work with me, I don't get to see firsthand the progress that they make and the just the change, the aha moments that they have. But I do get to see that still with the few one-on-one clients that I do have, and it makes it so worth it. That and being able to connect with people in community who have professions similar to me but different, and being able to collaborate with them on creating programming for larger communities, for organizations, and being able to walk into an organization and run a really powerful and really engaging program for them on peak performance and burnout reduction, or burnout prevention rather, and having people come up to me afterwards and ask me questions and tell me, this was so powerful, this is so meaningful, I'm taking this with me, and I'm implementing this right away, and then getting the feedback later and saying how valuable it was and what a change that people have seen in their organization. So from the being able to see change and see how meaningful the work that we do is on a one-to-one scale, but also on a larger scale, it keeps me going.
That's amazing. And Christina, if you had to do it all over again, and if you were meeting your 20-year-old self, what would you tell yourself?
That the bad days are worth it, that you're going to have them, that it's going to be really hard, and that if you don't live through, because I don't think I would do anything differently. Are there little things that, decisions that cost me money that I wish I didn't make? Of course. But at the same time, every single decision that I made got me here, from the decisions that led to something amazing to the ones that led to me having to problem solve and undo something that I did, or undo something that somebody else did. I don't think that I'd be here if everything just went well and everything just went right. I think I'd be bored. I think most people would. I think that we have to fail. We have to make mistakes, and we have to have the days where we want to rip our hair out and quit, and in order to know in order to really feel the value of whatever it is that we're building. And so I would just tell 20-year-old me, it's gonna suck sometimes. It's probably gonna suck maybe 60% of the time, but that other 40%, it'll be so good, it'll be so worth it, and then eventually we'll chip away at the negative bad days.
And Christina, so what's coming up for the next year for the business, and where can people find you?
So a couple of things. So the hope is right now we have two locations in Nassau County, and the hope is in the next couple of years to expand maybe into Queens and be able to offer to more of the population that we already serve, and serve more people. The other thing that's coming up in the next year is I'm collaborating with a wonderful executive coach whose company is Carnelian, and her name is also Christina, as funny as that is. And the two of us are creating programming for organizations, specifically for leadership C-suite teams, and working with them on how to future-proof their organization and really work from top down on leadership strategies, especially in a climate that is so volatile and where burnout is so significant, and where the hiring pool right now values self-care, freedom of self-expression over achievement and learning. And so how do we bridge a gap between generations? So we're building a really beautiful and amazing program. And so I can be found on LinkedIn. You can find me through my website, expressiveconnectionsmhc.com. I am so open to anyone messaging me with questions or just reaching out and just saying hi. I love networking with fellow entrepreneurs and just people who are in the same space as me, or anybody who's interested in learning more about what we do.
Amazing. Thank you so much, Christina, for coming on the show today and sharing your experiences and your insights with our audience. It was a real pleasure to have you.
Thank you for having me. This was wonderful.
And that wraps up today's episode. My name is Anne-Lise Cailliez, and I can't wait to join you again next week. Thanks for listening to Parlez-Vous CEO today. If you enjoyed the show, leave a 5-star review. It helps us keep going. And connect with us on Instagram at Parlez-Vous CEO. I am Anne-Lise Cailliez, and I know some days are harder than others. On those tough days, think back to why you started. What you're doing today matters, even when you can't see the results yet. Ideas are great, but it's what you do with them that counts. Find everything we talked about today at parlezvousceo.com. See you next week, and you've got this.